The views and opinions expressed do not necessarily reflect those of Access Fort Wayne, the Allen County Public Library, or any other supporting groups. If you'd like to produce a show, call us at 260-421-1250.
Let me be your lighthouse so I can show you the way. Let me be your shining light, keep you from drifting away. I'm the one that makes you try when.
Hello. This is Patty Hunter of Patty's Page. Welcome to my show, eh? This nice person beside me is John Dickmeyer, my co-host.
Hello, Patty.
Yeah.
How are you?
I'm doing fine. And to our right is Kayevonne Dailey.
Good morning.
Good morning.
Excuse me.
And
Good morning.
Kayevonne,
Good morning.
what is your title?
Executive Director of Women's Health Link, nonprofit organization here in Fort Wayne serving the needs of women, pregnant women, and also a commissioner for Indiana Commission for Women, where we address the needs of women across the state of Indiana.
When you say needs, what's that?
Needs. We, in terms of Women's Health Link,
Right.
addressing the needs of pregnant women, we want to make certain that, one, women that are sexually active have access to quality health care, making certain that they're getting their pregnancy test early as possible, STD testing as early as possible, and if they are pregnant, we want to make certain that they are accessing quality health care, getting them to an OBGYN to start their prenatal care as early as possible.
Do you have your own OBGYNs working for you?
I don't have OBGYNs working for me. However, I do have partnerships established with Parkview Health, for instance, where we will refer young women or expecting moms to Parkview Physicians Group.
So where were you born, my
I
friend?
was born in Clarksville, Tennessee.
All right. Hang on.
Relocated to Fort Wayne. I'm an Army brat. My parents and I lived at North Carolina, Fort Bragg, North Carolina, for probably 5 short years of my life, and we relocated to Fort Wayne, where my entire family resides.
So you went to school, the usual bit.
Yes.
So to become what you are now, what did you have to go through? A university, college, on-the-job learning, or
Both.
on-the-job learning?
I have
too?
I have one life experience that's contributed to my success as a director of organization. I've been serving my community for several years, believe it or not.
Yeah.
I started out in the for-profit sector, and when we had a housing crisis,
Yes.
I then secured a position with a housing counseling agency, the Fort Wayne Urban League, helping homeowners that were in default on their mortgage. That's where I got my first glimpse of the nonprofit world and the needs of our community.
Do you work with the homeless?
I have worked with homeless, yes. I've been certified in homeless prevention services. So many of our young women, single moms, pregnant women are definitely in need of housing. Some are homeless and doing what I call couch surfing. We'll go from home to home. The main thing is that they're in need of stable housing, and there are steps that women will take, especially women with children will need to take in order to become stably housed.
Do you also help women who have come from a domestic abuse,
I have.
especially with children?
Yes, I have. Encouraging women to get out of that relationship, encouraging women to seek counseling and possibly even shelter if they are currently in a domestic situation or relationship.
Especially if they're pregnant, too.
Absolutely. Actually, recently, Women's Health Link, Fort Wayne Urban League, Zeta Sorority, we are recipients of a grant through Parkview Health addressing infant mortality. One of the things that we will do is offer seminars for pregnant women or women who are thinking of becoming pregnant. Our next seminar will discuss stress and pregnancy.
So when is the next seminar?
The next seminar, good question. That will be,
October
I believe, October.
10th.
No, October 3rd.
October 3rd?
This is a total different event.
Oh.
And again, this is an event.
Oh, you have a banquet.
We have placed the banquet on hold for various reasons. And I do apologize if I didn't make you aware of that, but
No.
that'll be coming at a later time.
Okay.
So our focus right now, Women's Health Link is focusing on the infant mortality, the high rate of infant mortality among African American babies in the 46806 zip code. We are probably the among the highest in the state.
Not good.
Our babies are dying. And meaning babies are dying at birth between the age of 0 and 12 months.
Why?
There's various reasons. One of the reasons that has been named is premature birth.
I was preemie.
Yeah. So there are other, factors contributing to that.
Finance.
I don't necessarily, finance hasn't been named as one, but the health of the mother and the women lacking access to prenatal care, maybe 10 or less visits to the doctor.
And how about SID?
SIDS death is still a chronic problem among our babies that are dying.
Do you deal with Planned Parenthood victims?
I do. I've just recently started a post-abortive support group Bible study. I have actually just started a class or a Bible study for women who have been traumatized by abortion. And
Where is it?
I'm sorry?
Where are you teaching?
Right now I'm teaching the Bible study at the individual's home.
Oh, yeah.
And I will look to host Bible studies at local churches in the inner city.
Yes.
Where, again, African American women are targeted by Planned Parenthood to abort their babies, and our babies are dying in the womb at an alarming rate. So we want to make certain that women are aware that there are alternatives to abortion. And for those who have a past abortion experience, we want to make certain that we are there supporting them as they work through the trauma.
Yes. Do you have lawyers to make sure that the women are safe, especially when there's domestic violence?
Not necessarily, no. And one of the things that Women's Health Link we will do is refer women to various services or organizations that can meet that need.
Yeah.
And so if it is a woman who is a victim of domestic violence, of course we will refer to those organizations that will best serve women who are experiencing violence.
So basically you're a wellness, are you a wellness organization for the health of the woman mentally, physically, spiritually?
You could say that, yes. Yes, we will. We are there again for women who think they're pregnant. We want them to know that they don't walk alone.
They don't have to abort.
They don't have to abort their babies. There are other alternatives, as I mentioned earlier, to abortion, whether it's choosing to carry the baby to term. And then some mothers who do that have definitely made the choice to keep their babies. And for those who are at the point of delivery and choose, to adoption, and that is an alternative to abortion. So I believe abortion harms women.
Yes.
It kills our babies, and it harms women spiritually, physically, and emotionally.
So you, like I already asked you this, but do you deal a lot with post-abortive women? Are you just, you said you're just starting out?
We're just starting that service.
Yeah.
So
how long has that been in existence, that service?
This service, this will be my first class or Bible study.
Good.
And so I hope to do more in the near future, especially around the first of the year 2017. I'd like to see the classes are anywhere from 8 weeks to 12 weeks, so I'd like to host about 3 to 4 Bible studies, if not more.
Do you deal with people who have had abortions when they're in their 60s or 40s. It doesn't really matter how old the woman is, whether it's fresh or it's been years and years later. It still affects the woman's body and mind.
Right. Women that have an abortion experience are affected for a lifetime, especially if they do not seek the proper treatment
I know
or
people
support.
who have done that.
Yes, and so that it doesn't go away. The
No.
emotional effects, whether it's depression, whether it's suicidal, whether suicidal thoughts, I should say, whether many women have turned to substance abuse to cope with the emotional stress that comes, or trauma.
Sexual being sexually promiscuous.
That can be, but in most cases, women who have aborted, studies have shown that they will seek to replace the baby by having what we call a repeat baby.
Later, yeah.
And so, and one of the things that women may not have thought about for those who are considering abortion, those who abort will still experience the grief or loss of a child.
Mm-hmm.
And some women don't necessarily have that place to grieve the loss of the baby. So still go through, whether it was a live birth or whether it's abortion and the baby dies, no matter how the baby dies, it's still that
has to
grief
be a
that they
closure.
will experience.
There
Yeah.
has to be a closure.
The issue, I think, in this particular case is that the other significant people around that woman are not always helpful, whether they be parents or male relatives or even what would have been the birth father. They believe that with the procedure that everything has been settled, and we know that in our lives nothing is ever settled. There's always emotional rebound for all kinds of things for which we're invested in.
Absolutely.
And that's the real issue, that we don't deal with those things, and the people that are out there that perform the procedure definitely don't do anything either, and the people that counsel to get folks to do those things don't.
Right.
Oh, are you a counselor yourself?
No, I am not.
But you do have counselors helping you out, partnership.
We have, we will refer women that experience trauma from abortion. We can refer to counseling for mental health counseling. There are support groups out there for long-term support of women who have experienced the trauma of an abortion. So whatever her needs are, through our training, we're trained to identify if a woman may need additional counseling from a licensed mental health counselor, and we'll definitely refer out for those services.
So you have a lot of resources.
Yes, we have a mental health counselor on our board, and so we're very well equipped
Yes.
to serve women who have had a past abortion experience.
That's a
And
lot.
there are, and I can't recall the exact statistics or data that identify the number of women in the African American community that has aborted, but it's twice as many as Caucasian or white
Caucasian,
women
Spanish.
that abort. Absolutely. And so, as John mentioned, that the trauma is lasting. The decision to abort, for that 1 second, that one split second, one decision will significantly alter a woman's life, one that chooses that abortion. And so it is important that women know that they, should receive counseling so many hours prior to the abortion. and not certain of what type of counseling they receive when they go in for an abortion.
Right.
But again, there are organizations like Women's Health Link, our pregnancy resource centers that are there to encourage women not only to choose life, but to help her understand by explaining what happens during that abortion experience and the trauma that will last for a lifetime. And you had mentioned that older women in their 60s, that have had a past abortion experience and are still grieving and suffering the
children,
trauma.
And they take it out on their children. Either they don't let them go.
Well, it affects our whole person,
Yes.
a woman's entire.
It affects your children.
It affects our relationships,
Right.
whether it's with the father of the child, whether
Right.
it's with other members of the family, including children. Because of that, again, the negative emotions that occur after the abortion, and in most cases, the guilt.
I can't fathom how a person feels after an abortion. I just can't fathom. I know it's just complete grief and overwhelming.
I can. I am post-abortive,
Yes.
and the trauma that I experienced, the emotions, it devastated my life. As much as I can say, the guilt, the shame, the feelings of unworthiness of just being a woman was very traumatizing, and like most women, didn't understand what was going on with me, and
It's kind of hard to talk about.
it is hard to talk about. It gets easier, one, because I've had the opportunity to participate in a
People are
Bible
helping
study,
you. People help you.
and that support is there
Yes.
for women who have had a past abortion experience. I've had the privilege of benefiting from those services, and it just really changed my life. Going through that Bible study, it was really an opportunity for me to address the problem that got me there in the first place. In making that choice, I had an opportunity to really relieve others who were involved in that decision, and really letting them off the hook, and letting them off the hook, forgiving them
Yes.
for their
God
participation
forgives.
in that decision. And so from that point on, from that Bible study up to this point in my life, I've been able to, one, deal with those negative emotions, the trauma that I suffered for years, and now I'm able to help others. And I want women to know that there not only are alternatives to abortion, but for those who have experienced an abortion, that there is support available. They're not alone.
I bet there's a lot of women who are not religious who come to you because of the post-abortion or the being helped by you.
Mm-hmm.
How can you help them, a post-abortive person who's not God-centered?
And of course, you want to be very sensitive to and respectful of a woman's religious views. And there's various studies out there that one can use. I think we're very sensitive in how we minister to her or talk with her about abortion. And it's not necessarily to proselytize or, of course, freedom. I believe, as a Christian woman, that a true freedom comes through Christ.
Yes.
That's the only way. I believe that, but I believe also that we have to then walk alongside others, introduce them slowly to the Lord. It's through building that relationship with her. It is really helping her identify her spiritual views as she addresses the trauma. So I believe we need to be careful that we're not preaching Christ and posting judgment on women, because that's not what we're here to do. I believe God delivers, He heals, He convicts, and we're here to help in a loving way her through that journey.
When did Women's Health Link start here in Fort Wayne?
Women's Health Link began about 3 years ago.
3 years? Is that
I
all?
believe it's been 3
Oh
years.
my goodness.
Yep. And
How
I
long have you
have been director of the organization for the past 2 years.
Mazel tov.
I'm sorry?
Mazel tov. Your turn.
Yeah.
Very good.
Thank you.
I'd like to pursue a different way of looking at this. You know, pregnancy is a difficult journey for a woman, and we've talked about all the difficulties that people who come from a less affluent environment run into. And I agree with you, and I agree with the statistics that proper medical treatment, going to all of the OBGYN appointments that the professionals want to track the pregnancy all the way through to delivery. That is really, really super important. But let's talk a little bit about nutrition and the kind of beverages and other substances that
you
women
mean talking
take.
about alcohol, tobacco, or drugs?
Yeah, the whole thing. Can you address that for us, please?
Somewhat. I'm not a nutritionist, and that's why we have our OBGYNs there that will, that healthcare professional and other organizations that will encourage women on eating healthy, types of foods that is important to them during pregnancy, the different vitamins that they need to be taking during pregnancy, and the things that they should definitely abstain from, which would definitely be drugs, alcohol, and tobacco. You read on the packages that tobacco could harm pregnant women and cause birth defects. So those type of things that women should definitely stay away from and be as healthy prior to pregnancy as possible, but if not during pregnancy.
Do you deal with the police if they're high on something?
Do I deal with the police?
Do you bring the police in if there's
No.
there's something?
No, I would
not
most
right?
likely refer to the hospital or to a behavioral health.
ECE, what's that word? Certain branch of the police department that handles.
Yeah, especially if that individual is not, harming themselves.
Yes.
Of course, if there's a threat, if they're a threat to themselves or they're suicidal, people do weird things off drugs. If they're suicidal or looking to harm themselves or others, definitely we need to report.
Yes.
But if that woman, is showing some signs of that she's been using, I would definitely refer to a mental health counselor and or the hospital if there's an emergency situation.
I have a question.
Yes.
Something has entered our country. It's called Zika. It's causing damage to our babies. It started in Florida, did it? It's coming out from the south.
In the United
In the United
States.
States, yes. Has anyone come to you with that sort of problem yet, or asking you questions about Zika?
No. It doesn't appear that there's a huge concern here in Indiana yet. But of course, it's a growing concern across the nation. I haven't had a woman that has expressed any concern about being infected by the Zika virus.
But if they go to Florida or down south and they come back with a disease, how can that be addressed? I mean, how can we heal that?
Well,
Do they
I don't know. I follow it on the news, and that's about as much as I know. I know enough to be dangerous, but definitely, if she feels she's been bitten by a mosquito with the Zika virus, it's going maybe to the health department or to the doctors, especially in getting the necessary tests to determine if she's been affected or not.
And if she has been affected, I don't want Planned Parenthood making this an excuse to do more abortions.
And I'm certain they will, and I believe I've heard
They
something
would
on the
try.
national news that
Yeah.
there was, Congress was addressing the bill to get monies to address the Zika,
Yes.
to kill the mosquitoes.
Yes.
And there was discussion, I guess, about Planned Parenthood really getting on that bill, that the only way that they would get monies or something would be to fund Planned Parenthood.
Well, we better change that.
And that's as much knowledge as I have about
Yeah,
that,
yeah.
but I could see where that could happen because, you know, Planned Parenthood encourages women to abort their babies whether they're healthy or not, but especially if they know that the baby,
It's going
the
to be
unborn,
defective.
is unhealthy. They definitely
They-
will encourage women.
Well, this is towards the end of the show, Kayevonne. What would you like to say to my audience to encourage them to come see you when they're pregnant or need health issues looked at?
Yes, I would definitely want to encourage any woman who thinks that she may be pregnant to contact Women's Health Link at 260-203-2365. We can make certain that women, again, are getting to the doctor and where they will have an opportunity to be cared for and receive quality health care. That's our main goal. We want them to get there as early as possible, so definitely give us a call. And if there's any other related needs that they may have, can call us and we can get them referred to the appropriate agency.
This is Kayevonne Dailey. She's a director as well. And we love you, girl, for what you are
Love
doing.
you too. Thank you.
Thank you. Thank you, sir. Thank you, sir.
Thank you.
Oh, okay. Now. Okay. Oh, I have good grip.
Good grip.
Are we done?
Yes. This
We
one.
we are finished, aren't we,
Yes,
Patty?
we are.
Say
I like-
goodbye, Patty.
Oh, bye.
Well,
You're always in my heart and every dream. Don't let this time apart give in to all our fears. God will keep us close from up above. So until we meet again, Godspeed, my